Hi, I'm Christine Martin of Future Health Management. I'm a naturopathic consultant. Today I'm going to be looking at the ALCAT test. I don't know how many of you are familiar with the ALCAT test, but it's a food intolerance test, and it's a simple blood test that will actually determine what foods trigger any unwanted inflammation, what foods are severe, moderate, mild, or even acceptable with no reaction. And it also allows you to personalize a nutrition plan. And it's amazing how you feel mentally, both physically, when you've actually changed your diet or even lifestyle, just making some lifestyle changes. And of course, it's so important to feel really, really good. And also in terms of, if you're working or you're self-employed, you can't really afford to be sick. So let's see what cell science systems have to say about their ALCAT test.
How often does a physician have a patient coming in year after year? And the patient presents with high blood pressure, condition of overweight or obesity, other risk factors for serious diseases like poor blood sugar control. And how often does that health care practitioner say to the patient, you really need to make some changes in your life. You need to exercise more. You need to eat better. And nothing happens. Well, we can provide that support to the healthcare practitioner to perform the testing and find out what foods and chemicals and so forth need to be avoided and which are safe, but also to guide and support that patient in the implementation of changes in their diet and lifestyle.
Immune cells, when activated, produce both free radicals and inflammatory substances that can cause tissue damage and premature aging. Food sensitivities have been associated with many conditions, including migraine, rashes, overweight, arthritis, fatigue, respiratory, GI disorders, and many others.
Test results are evaluated and then formatted into an easy-to-read and easy-to-interpret color-coded report. For each test substance, cellular responses are categorized according to degree of reactivity: severely reactive, moderately reactive, mildly reactive, or non-reactive. And many factors can impact these results. Some contributors would be the frequency of exposure, overall detoxification ability, the presence of cofactors which may vary according to the season, and also intestinal permeability could be an issue. With increased intestinal permeability, this could be the result of one or a combination of factors, such as stress, certain medications, infection, and the gut microbiome. Whereas any cellular reaction may be significant, it's more likely that a stronger cellular reaction will be associated with a clinical response. From here, your healthcare provider or an ALCAT nutritional consultant can advise you with regard to what foods to avoid, what foods to consume, and how to build a varied, nutritious eating pattern.
This is a tool that can be very powerfully used by healthcare practitioners to help people overcome symptoms which don't respond to other therapies or other approaches. About 70% of illness can be prevented merely by changes in lifestyle, which includes diet. So by managing stress and exercising and eating a proper diet, which would be a healthful diet, but also a diet which is constructed according to the unique characteristics of each individual's biochemical and genetic makeup, I think that we can really avoid a lot of the chronic disease that we see flourishing in our society. And considering that we spend upwards of $2 trillion a year on healthcare, and so many of these problems can be prevented through simple measures that are healthy, we can then reallocate that effort and those funds for perhaps greater prevention and other things that improve the quality of life and social programs that there's no shortage of needs to fulfill.